we are going to talk about the signs and symptoms of a cerebrovascular accident, a stroke. And the first one on my list is a reduction in the level of consciousness. Now, depending on the site or the extent of the stroke caused, so for example, if the stroke tends to happen in the brainstem, then that can cause reduced consciousness. Because even though it is not true or it is not clear about how consciousness is generated in the body, but it is believed that the level of consciousness can be generated from the brainstem. So if the stroke or anything damage to that part, and that can lead to reduced level of consciousness. But if the patient has got a stroke and then that stroke does not reach the brainstem, then that simply means the patient's level of consciousness will be okay, but the stroke is still present. So a reduction in the level of consciousness when we are doing it on the classical coma scale, and that simply shows that the stroke is in the brainstem or it has reached the brainstem otherwise. The second thing I want to talk about is paralysis, and that is hemiplegia. Hemiplegia. Now, hemi means one side of the body, half of the body. Plegia means paralysis. So hemiplegia is paralysis of half of the body or one side of the body. And this is true because we know that it is the left cerebral cortex which controls the right side of the body. And also it is also true that it is the right cerebral cortex which controls the left side of the body. So if there is a fault in the left cerebral hemisphere, then that paralysis is going to be in the right side of the body. And hence, this is vice versa. If there is a fault in the right cerebral hemisphere, then paralysis is going to be on the left side of the body. So this is important clinically, because when the patient comes in, they are paralyzed in the left side of the body. They can't move, they can't feel, they can't do anything. Then we are going to know that maybe the part of the brain which is affected is this side of the brain. If they come, they are paralyzed on the left side of the body, then we are going to know that it is the right side of the brain which is affected. So this is very important. And as well as that, there's going to be hemiparesis. Now, hemi, as we say, hemi means half of the body. Paralysis, this is weakness. So, hemiparalysis, weakness on half of the body or weakness on either side of the body. So, for example, there can be weakness on the right side of the body, or there can be weakness on the left side of the body. It means weakness. Also, there's going to be difficulty in speech, and this is what we call aphasia. Sorry, aphasia. Aphasia is difficulty in speech. Now, for us to dwell on this one, it is true that the speech centers are located in one of the most dominant hemispheres in our body. So, for example, if someone is left-handed, then their speech centers are located in the right cerebral hemisphere. And if someone is left-handed, then that simply means that their most dominant cerebral hemisphere is in the right cerebral hemisphere, or the right side of the brain. And if someone is right-handed, like me, I'm right-handed. So that simply means that my most dominant cerebral hemisphere is the left cerebral hemisphere, and that is where my speech centers are. Why are we saying this? Well, we want to identify which side of the body or the brain has been affected upon presentation of clinical signs of our patient, depending on speech. So, for example, if someone has got speech problems, and if that person is light-handed, then we are going to tell that, okay, the problem is probably in the left cerebral hemisphere, because that is where their speech centers are, because they are light-handed. And if someone has got speech problems, but they are left-handed, then that simply means that the problem is in the right cerebral hemisphere, because that is where their speech centers are located in the brain. So it is very important, upon presentation of clinical signs for our patients, we know that, okay, this is the part of the brain which is being affected. Also, there can be seizures, of course. Now, seizures tend to present, but quickly they can go. So it is very important also that we identify these things. Also, the patient may tend to forget quickly. The patient may tend to be forgetting things quickly because their speech centers, the brain has been affected. So all those things are going to be there. And as well as that, there's going to be dysphasia. Now, dysphasia is not knowing what word you are going to say, but you want to say it, but you can't remember what to say. This is so because the Broca's area in the brain, because we also know that the Broca's area, as we know, is a part of the brain which gives us the word to speak. So I'm able to speak to you right now. I'm able to say this. I'm able to write this. I'm able to read this, because it is the Broca's area of the brain which is giving me that word. So suppose I want to remember something I forgot, and then the Broca's area will turn on, and then will take that word from the mind, and then it will give me the word ready for me to speak. But in these patients, dysphasic patients, the Broca's area is affected, and they can't be given the word to say. So the result is they will be dysphagic. They will want to speak, but they can't remember the word to say. And the opposite is this, is dysarthria. Because in dysarthria, the patients will have the word to say, but they can't move their mouth. So the patients who have the words to say, they will remember the words to say, they will have it in their head, but they can't speak that word. They can't say it out. Dysarthria. The other thing is there is going to be loss of sensory perception, loss of sensation, of course. And loss of sensation is associated with the sensory cortex, in the brain. In the brain, we know that there's an area of the brain behind the frontal lobe. There's an area called the motor cortex, and behind that there is a sulcus which divides the two lobes, the frontal lobe and the parietal lobe, and just behind that there is what we call the sensory cortex, and that is where the sensation is generated from, because in that area there is either a sensorily little man or a sensorily little woman, and that is where our sensation is taken from. Of course, that's called the homunculus. So if that part of the brain has been affected, then that simply means we are going to have difficulty in sensation. Also, there is going to be loss of movement. And loss of movement also is coming as a result of the motor cortex, of course, being involved, because the motor cortex is where we generate all body movement, and this is important if we recognize these clinical signs and symptoms, and that will lead us to the treatment and the type of medication that we are going to give to our patients. Because ischemic causes of stroke, what we are going to give is a thrombolytic therapy, because what this does is that it's going to dissolve all the blood clots which are there in the blood vessels, and then make that into a liquid form that will, of course, protect the stroke. But given that in the hemorrhagic causes of stroke, it's very contraindicated, because all the blood vessels, all the blood clots that were formed in order to stop the hemorrhage which has already begun, are going to be dissolved when you give the thrombolytic therapy. So it is very important that we do recognize the type of stroke before we begin our treatment. So in the next video, we are going to talk about the treatment for CVA.